Hello everyone, I'm Dr. Rohan Khandelwal. I'm a breast cancer surgeon and a surgery faculty as well. Today I'll be talking about tips for freshly joined surgery residents. How should they be approaching their residency? So if you've recently joined a surgery residency or you're about to join it, first of all, heartiest congratulations. You're about to enter a branch which is highly rewarding. Yes, you need to work really hard, but the gratification which you get when you see a patient getting better after surgery is immense. Now, as a first year surgery resident, things are going to be tough for you, and I'm not going to mince my words. They will be difficult in the first few months, and there are certain reasons for it. Look, you'd been preparing for your entrance exam sitting at home or sitting in library. You're not used to that kind of a physical effort, and suddenly you join a surgery residency where on an average you would need to walk around 15 to 20,000 steps a day. You would need to climb multiple floors multiple times, and you would need to deal with multiple orders from multiple people. And that can become physically and mentally challenging in the initial few days. So first thing which I want to advise to all of you is that go in with an open mind and an open approach, right? Talk to your seniors, talk to your immediate postgraduates, senior postgraduates, senior residents, because these are the people whom you're going to spend maximum time with. So spend some time in building a rapport with them. Please understand that friendly banter and a few jokes here and there are good, but if it crosses that boundary, if you think that you are being harassed or ragged, put your foot down, discuss with them, and that is the best way to sort out things. Spend time with the nurses there, because these are the people who are going to be there in the ward all the time, and there is so much to learn from them in terms of how to talk to patients, how to handle drips, how to change IV lines, how to do dressings, how to prevent bed sores. I mean, the knowledge which I learned from nurses with regards to bed sore prevention is tremendous, and it will stick with me for the rest of my life. So that's my first advice. Go with an open approach. Try to build a rapport with your seniors. Second, you need to understand that yes, you're joining a surgery residency, but don't start expecting that you'll start operating within the first 15 days or within the first month. First, you need to learn the nuances of ward work, which sometimes would involve mundane tasks like just filling out lab forms or taking samples or putting IV lines. But trust me, they are important, right? They all are important, and they all are a part of a rapport building exercise. I would only trust somebody whom a junior, I can only trust them with the surgery when I know that they can do all the other work in a seamless manner, and when I have faith on them. And that is what you need to do in the first month to month and a half. Okay. Would you get time to read? Well, that depends on every residency program. What would I carry in my coat pocket? Well, I would carry something like a dressing technique, something like Pye's surgical handicraft, or just a Washington manual of surgery, or a pocket book which I can refer to sometimes if I need to know something, or if I have spare time I can go through it. Right? These books would teach you practical aspects of surgery which one needs to know. Also, my advice to all of you, I'll come to studies again later on and how to choose a surgical subspecialty, but also in your coat pocket, always carry some nutrition for you, because you'll be working long hours. You need to have some nuts, some candy bars, or something sweet with you, which you can consume whenever you get a chance. Keep yourself hydrated. It's very important, and sometimes in a long day, you forget hydration. Whenever you get a chance, eat. It's important. And also invest in a good pair of shoes. I think so that's going to be your best investment, and you will thank me later for that, because you have to walk a lot, and having a comfortable pair of footwear goes a long way in helping you with that. Eventually, you will start going to the theater as well, and you will start doing surgeries. Now, please remember, don't compete with your fellow colleagues, right? Somebody by the end of 3 years would do 20 perforation surgeries, for example, and somebody would do 150 or 100 of them, right? What you need to understand is that every surgery has a learning curve. And as long as your residency is allowing you to cross the learning curve for the basic procedures, you should be content. Because once you've crossed the learning curve, whether you've done 50 or 55 or 60, it would hardly make a difference, right? Also, some students just look at cutting opportunities of basic surgeries. But another very important aspect is the width, is the wide array of surgeries which you're going to be exposed to. So it is better to choose a residency program where you can see a wide variety of cases as well, because that will broaden your horizon and it will help you in choosing what you need to do in future. Also, as residents, please, in the first year, try to attend a suture workshop, right? These suturing workshops happen at various places in various cities, and they will help you in teaching you the basics of donning gloves, donning a gown, how to take care of sharps, how to do basic suturing, how to tie a vessel. All these things are extremely helpful, and usually your seniors are very cooperative in sending you out for these one-day long workshops. Try to attend conferences, because sometimes a particular type of surgery might not be happening in your department, but when you go to conferences, you see other people present, you see what else is happening, that again broadens your horizon. Now, some students have just entered first year and they've started messaging me about super speciality and how do they study for that. I think so it's too early for that right now. For the first 6 to 8 months, focus on your ward work, focus on learning the basic skills. Spend as much time as you can in the minor OTs which are associated with the OPDs, because that's where you'll get to do most cases, right? After 6 or 8 months, you should start thinking. If you already have something in mind, you work on that. Otherwise, like I said, by seeing more surgeries, by going to more conferences, you can broaden your horizon and see what you like or what would be something which you would want to do for the next 30 or 40 years. Now, invariably, a lot of students end up choosing GI surgery, and the reason for that is that you're most exposed to GI surgeries in your residency, GI emergencies as well. So that is one aspect, but always give yourself other options as well. You should get serious about your super specialty training or preparation by second year, towards the mid of second year or end of second year. That's the best time, according to me, to start preparing for your super specialty. So I think so I've covered a lot of points in a short video, and I hope you find this useful. If you have anything else which you have in mind, please do write in the comment section and I'll be happy to answer that. Thank you.